Hello everyone and welcome back to the channel. In today's video, we're going to talk about delegation, which is a very common topic on the NCLEX. Delegation questions test whether you understand which nursing task can be assigned to other members of the healthcare team, such as the LPNs and the UAPs. UAP simply means unlicensed assistive personnel. And many students get these questions wrong because they don't clearly understand the roles of each team member. But once you understand the pattern, then delegation becomes easier for you to answer. What is delegation? Just as the word is to delegate something, delegation means assigning a task to another member of the healthcare team while the RN remains responsible for the overall care. So the RN does the delegation. The RN decides who does what. Oh, the LPN, this is what you should do. The UAP, this is the task for you, and then also assigns task for herself or himself as the RN. This means that even though somebody else performs the task, the registered nurse is still accountable for the outcome because it's the registered nurse that does the delegation. For example, an RN may delegate taking vitals to a UAP. The UAP measures the blood pressure, but the RN is still responsible for reviewing those results and deciding what to do if the values are abnormal. All right. On the NCLEX, you should always ask yourself, is this task safe for somebody else to perform, or does it require the nurse's critical thinking? Now, there are some tasks that the RN must do, and these tasks cannot be delegated. The RN cannot delegate assessment, developing nursing care plan, teaching patients, and evaluating patient outcomes. For example, if a newly diagnosed diabetic patient needs to learn how to inject insulin, that teaching must be done by the RN, not the LPN, not the UAP, and the RN cannot delegate this. Another example is the initial assessment of maybe a patient who has just been admitted into a unit. That assessment requires clinical judgment, so it must be performed by the registered nurse. Now, what you should always have in mind is that these four tasks, the assessments, teaching, care planning, and evaluation, usually cannot be delegated. The RN cannot delegate these things because they require critical thinking. Coming to the LPNs, there are tasks that the LPN can perform. They can perform many nursing tasks, but they usually care for patients who are stable and whose condition are predictable. LPNs can administer certain medications, perform dressing changes, monitor patients' conditions. They can also reinforce teaching that has already been provided by the RN. Note the word here, reinforce. LPNs don't teach, they can only reinforce teaching. A teaching that has been done by the RN. If you remember, patient teaching is done by the RN, not the LPN. However, the LPN can reinforce the teaching. It has already been done by the RN. They can only reinforce teaching that has been done by the RN. For example, if an RN has already taught a patient how to care for a surgical wound, the LPN can remind the patient of those instructions later. However, the initial patient education, like I said, must be done by the RN. Okay? For the UAPs, there are also tasks that the UAPs can perform. They can perform basic patient care tasks because these tasks usually do not require clinical judgment. For example, they can help patients to bathe, assist with feeding, help patients to walk, measure intake and output, take routine vital signs. Routine vital signs, not vital signs for unstable patients. Take note. For instance, if a patient needs help walking to the bathroom or needs assistance with bathing, this task can be safely delegated to a UAP. Like I said, if the patient is unstable or showing signs of distress, then the RN should assess the patient first before delegating any task to the UAP. Now, here are some rules for delegation. You can note them because they're going to help you in attempting delegation questions. Don't delegate tasks involving unstable patients, patient assessment, patient teaching, or evaluation of care. These tasks require the nurse's clinical judgment. For example, if a patient suddenly becomes confused or develops shortness of breath, then the RN should assess the patient immediately rather than delegating the task to another team member. These are things we should not delegate. You don't delegate unstable patients, you don't delegate assessment or teaching or evaluation. Know these rules and it will help you to answer a lot of delegation questions. All right. Quick recap. RN does any task that requires critical thinking. Once it involves critical thinking or clinical judgment or something that would decide if a decision will be taken or not, like an assessment, planning, diagnosis, then the RN has to do it. Then for the LPNs, you delegate only stable patients, patients that their conditions are predictable, and things like changing wound dressing, administering oral medications, not IV medications. You can delegate it to the LPN. LPNs can perform wound dressing, like I said, but the first ever wound dressing, the first ever teaching, dressing, assessment, everything first should be done by the RN, then the LPN takes over. Like I said, for instance, for teaching of the patient, the RN does teaching, then the LPN can reinforce it. And first, maybe dressing after surgery should be done by the RN, then maybe the LPN can take over later when the patient is a lot more stable. Then for the UAPs, any routine care, any basic care. So we have a practice question here, but before we go to the practice question, if you're finding this video helpful, don't forget to like and to subscribe to the Academy for more NCLEX review lessons and for more practice questions. So the nurse is caring for 4 patients on a medical surgical unit. Which task is appropriate for the nurse to delegate to the UAP? Option A, assessing a patient's pain level after receiving medication. Option B, assisting a post-op patient with ambulation. Option C, teaching a patient how to use an incentive spirometer. And option D, evaluating the effectiveness of a pain medication. You can pause the video and try attempting the question. The correct answer to this question is option B, assisting a post-op patient with ambulation. And this is because doing this is a simple activity of daily living. It doesn't require any nursing judgment. It doesn't require any clinical judgment. So it can safely be delegated to a UAP. The other options, option A, option C, and option D, involve assessment, teaching, and evaluation, which must be performed by the RN. Okay, so thank you for watching, and in the next video we'll go over another high yield NCLEX topic to help you prepare confidently for your exam. Don't forget to subscribe, to like, and to share with somebody who might find it helpful. See you in the next class. Bye.